therapy, what can parents do at home? And how does that differ from when you have younger children in elementary school and then older middle and high school students?
So again, as I mentioned before, I think one of the best things that parents can do at home is to validate their kids' feelings and to not just try to take them away. We really want kids at an early age to learn how to be uncomfortable and to learn to rely on themselves rather than their environment. And parents are there to listen and only give strategies if the kids are asking for them. And so for elementary school students, that involves a lot more hands-on work. You know, you are hopefully modeling for your kids about what you do in your own anxious situations and how you may be anxious about a big presentation at work, but by the time you get home at night for dinner, you're feeling relaxed already. And so you want to model for your kids how anxiety goes up and it goes down. They're riding the wave of that, right? And you want to model for your kids the appropriate reaction to a certain problem level. Like if it's a small problem, we have a small reaction. If it's a medium problem, we have a medium reaction. Certainly modeling and putting limits around sleep, right? Having regular sleep routines, regular eating routines, and exercise routines. That is, of course, very, very helpful with anxiety management. And modeling good coping strategies, hanging out with friends, talking to people that you trust, even distraction techniques. With high school students, it's a little bit more hands-off, and I think it's harder for parents sometimes to be hands-off, but you really want to be encouraging your high school students to be making their own choices and decisions on their own. And then if there's a mistake, we support you. And kind of we reinforce taking risks, reinforce being creative, and reinforce effort rather than that final product of an A.
I like that. Yes, for sure. Whoops. And then lastly, what can kids do? Because we're not always around to help them.
Right. So, I mean, this, of course, is any therapist's, I think, favorite part of the treatment is working with the kids. And there are a ton of coping strategies. Kids are awesome at searching the internet high and low for things that they can do, like listening to music and mindfulness strategies. And schools are doing more and more of this also. Again, I always encourage kids to regulate their sleep, social media use, of course. Talking to their trusted friends. A lot of times by the time they're adolescents, their parents are not their trusted friends, so they'd rather talk to friends, and that's okay. Learning study skills and time management is probably one of the most helpful anxiety management strategies because so much of their anxiety has to do with school. And of course, when possible, talking to people at school and advocating for themselves.
Yeah, that's a big one, is being able to ask for help.